Thank you, Chairman. Welcome, Mr. Bernanke. On the long-term front, we are looking at $50–60 trillion worth of unfunded liabilities, i.e., we see the obligation coming, we haven't set aside a nickel to pay for them. Those seem to be the real, as the former Comptroller General said, swamp the ship of state problems. If we get through this financial problem with $7 trillion spent, that's 1/5 of the $35 trillion liability we own just for the Medicare slice of the healthcare tsunami that is bearing down on us. You spoke about this at Chairman Baucus's Finance Committee event earlier, and I'd like to sort of reprise those thoughts now. There are two ways we can go about solving this problem. We can wait until it's really upon us, and then we can apply the traditional fiscal solutions of throwing people off of their coverage, thinning out the benefits, paying providers less, or raising taxes to bring the fiscal cost of the system into balance. First, well, before I ask you about that, there's a second way, which is actually intervene in what is an astonishingly overpriced, underperforming, complex, and wasteful healthcare system, and design ways to actually bring down the cost, which, as many studies and experiments have shown, can be done while improving the quality of healthcare dramatically. And in this area, there are things like investing in health information infrastructure, and investing in quality improvement in ways that save cost, and investing in prevention in ways that save cost, and in reforming the payment system so that it's sending appropriate signals for the kind of system that we want. I see those as two very distinct choices. My worry is that the latter series, the more humane series, the reform series of options, take time to implement. And if we goof off and fiddle and let this moment pass, then we're left with that other set. We're left with throwing people off their coverage, thinning out the benefits, paying providers still less, and raising taxes. Looking at that second group, what do you think is the actual long-term viability in terms of solving our problem of resort to that fiscal toolbox of throwing people off the coverage, thinning out the benefits, cutting provider payments,
that's
and
both
raising taxes?
very difficult to do and very unattractive way to go, obviously.
Even if we did it, would it last long?
Just to give you a sense, you mentioned these very large unfunded obligations for Medicare. Those obligations are calculated assuming that medical costs grow at a rate 1% faster than per capita income. In fact, historically, that's been 2 to 2.5%. So even those projections assume a considerable improvement in the rate of cost control in the U.S. So I think it's very important, both in order to get a rational system and to get one that people can get used to and we can learn how to, by experience, how to make it work better. I think it's very important that we address these issues now. And frankly, in terms of the long-term entitlement issues, the medical issue, which has multiple dimensions. It involves cost, but it also involves access. It involves quality. Those are very, very tough problems. I do think that—
You said now. Can I ask you to, in my remaining minute, talk a little bit about how urgent that now is? Is that just we should do it now, or is there real pressure on us to get—
Well, I was asked this question at the Senate
now?
Finance Committee, and he asked me when we should start, and I said 10 years ago. So I think it is very urgent that we look at these issues and make some tough decisions. I mean, they're general public policy decisions about choices that have to be made about what kind of healthcare system we want to have and how we want to structure it.
Let me make just one observation in closing. I know what you're trying to do. I appreciate the efforts that you make to shore up the institutions that direct our financial system. You're concerned about the shock waves, as you said, through the insurance industry from an AIG failure. You're concerned about devastation in the financial services industry from the credit collapse. Just from Rhode Island's perspective, I submit that the Rhode Island business community, the small business community in particular, is suffering shock waves itself, that our neighborhoods are suffering devastation themselves. And the more that what we're doing focuses on these big institutions, the more it looks as if the masters of the universe who made this mess aren't truly being held accountable, and the less people at home see some real difference the more challenging it is going to be for us as a democracy to not only solve this problem, but to have the public goodwill necessary to solve the healthcare problem, necessary to solve the climate change problem stacked up behind that. If you blow all of the public's goodwill solving this problem, we are in serious trouble on the healthcare and the climate change and other troubles. So I'd urge you to bear that in mind.
Thank my colleagues.